Hello, my name is Stuart Howard. I am a nurse practitioner student. I'm going to Youngstown State University and I'm going to present a patient. My patient is a 22-year-old white female. She has a past medical history of anxiety with no medications. She has no surgical history. She presents today with 4 days of fever with a sore throat. Um, it She's had a dull frontal headache. She has sinus pressure with a sore throat. When she bends forwards and when she talks a lot, the pressure actually gets worse. She has actually taken Tylenol and some nasal saline, and that actually has given her some partial relief. It is persistent throughout the day, and it actually gets worse at night. It is moderately severe. It does interfere with her daily activities. For her review of systems, she has a fever, fatigue. She's got some sinus congestion, facial pressure, sore throat, headache with ear pressure. She denies cough, shortness of breath, or wheezing. She denies any chest pains or palpitations. She denies any nausea, vomiting, or diarrhea or abdominal pain. She does report a headache, but she denies dizziness, weakness, numbness, or confusion. She is a school teacher. She's married with no children. She denies any tobacco, alcohol, or any recreational drug use. Again, she's not on any medications. Her vital signs today, she does have a slight temperature of 100.8. Her heart rate is at 94 beats per minute. Her blood pressure is 118 over 74. Her respiratory rate is 18 per minute, and her oxygen is at 98%. We did some labs on her. We did a rapid strep, a COVID-19, an influenza, and also a monospot. The rapid strep, the COVID-19, and the influenza are all negative, but we are still waiting for the results for the monospot, since that was a blood test that we actually have to send out. She is, for her exam, she is alert and oriented with no acute distress. She does have some nasal mucosa that has arrhythmia with some thick discharge. She does have some frontal sinus tenderness with mild tonsillar arrhythmia with exudate. Her bilateral tympanic membranes are mildly bulging. Her neck is she does have some anterior cervical lymphadenopathy. Her neck is supple though. She has a regular heart rate with a regular rhythm with no murmurs. Her lungs are clear to auscultation with no wheezing or rhonchi. Her abdomen is soft, tender, non-distended. She has some normal bowel sounds. And again, she's alert, oriented times 3. She's a 22-year-old white female with a past medical history of anxiety, presenting with 4 days of fever, sinus congestion, sore throat, frontal headache, and bilateral ear pressure, with rapid infectious testing negative, and the monospot is pending. I would say that for my differential diagnosis, she has a viral upper respiratory infection. That would be my main diagnosis for it. Has only been 4 days. I could Another differential diagnosis could be acute bacterial sinusitis, especially if the symptoms persist or they get worse. It could be the infectious mononucleosis. Again, we are waiting for those test results to actually come back. Or it could be allergic rhinitis. The weather has been changing. It is September. And it could also be strep throat, because we actually didn't send out culture for that. And we did the rapid, and sometimes the rapid does show a false negative. So we are waiting for the monospot to come back. We would consider a sinus CT if symptoms persist, especially if it's been going on for greater than 10 days, or definitely worse after 7 days. So we would just consider that. We would definitely reassess the patient if her fever got greater than 102. And again, today was only 100.8. Our plan would be symptomatic management. So just continue for her to take the acetaminophen or Tylenol, hydration, the nasal saline rinses, and rest. We would not give antibiotics at this time, pending the monospot result, because if I give her an antibiotic, especially Augmentin, and she actually has mono, then she could actually get a rash from that, and that could exacerbate her illness. We tell her to avoid any strenuous activity, no contact sports until the mono is ruled out. Return precautions, so that would be if her worsening fever, she has any facial swelling, severe headache, chest pain, respiratory distress. We would ask her to follow up in 5 to 7 days or sooner if symptoms got worse. And let's say that the monospot actually did come back negative, and if in 3 days she still has a fever and a sore throat, then I would treat her with amoxicillin 500 milligrams orally 3 times a day for 10 days. Thank you.